So my name is Christopher Ransom. I'm an MD PhD neurologist, and I am an associate professor in the Department of Neurology and part of the Department of Neurobiology and Biophysics. Yeah, so I got here from some fantastic experiences as undergrad that got me excited about the brain and neuroscience in general, that motivated me to go to medical school and complete residency training in neurology. Specifically, I did some subspecialty training, fellowship in epilepsy. So that's mainly what I do clinically, is take care of veterans with epilepsy and other seizure disorders. And some of the things we're working on in the lab are directly related to epilepsy and other cellular and molecular alterations that occur in response to injury. My daily work routine really depends on the day, like everybody, but being a physician scientist, I have a fairly steady workflow of clinical related items that I keep busy with. My biggest clinical day is Tuesdays, when I have an outpatient clinic and I see patients. But I'm also involved in interpreting EEG studies, so electroencephalograms, both that are done as a routine outpatient study for diagnostic purposes, studies that are done on acutely ill patients in the high intensive care units here in the hospital. So we admit people for several days in this dedicated unit to record their seizures. They're not always epileptic seizures, but that's the main tool that allows us to define the etiology of an individual's transient recurrent events. Well, I think it is very inspiring getting to work on the brain and think about the brain and take care of people that have disorders of the brain, because it is still a mystical area in biology, and not to be dramatic about it, but as much detail and information we have about all of the cellular, molecular, and genetic factors that contribute to normal brain function and health, and how it's derailed in disease. There's still a lot of stuff we don't totally understand, like what's allowing us to think and plan and experience emotions. And so everything we do, of course, is dependent on the brain. And so that's really inspiring, and I think keeps neuroscience really exciting, and my job always fascinating, and there's always an opportunity to learn new things. The connection is very powerful, and so in individuals age 18 to 45, traumatic brain injury is the #1 cause of epilepsy. But not all traumatic brain injuries are created equal, obviously. So there's a whole spectrum from mild to moderate and severe. It's those most severe types of TBI that carry the highest risk for developing epilepsy. And of course, at the VA, that's a real priority area, because there's combat veterans who suffered gunshot wounds to the head and other severe TBI that are high risk for developing epilepsy. And not only seizures, but these same cellular and molecular changes that happen in the brain after TBI also contribute to mood disorders, sleep dysfunction, headaches is really common. They're probably all connected at some level. And so the other part, the consequences of the seizures, that also can be variable. The good news about epilepsy as a neurologist taking care of a serious neurologic condition is we do pretty well controlling seizures with medications. Upwards of 66% of people, close to 70% of individuals will never have another seizure once we have a medication that they can take and tolerate, and we can control those with medication. So that's a pretty good outcome. But there's this hardcore group of patients that seizures, despite trying numerous different medications, where we never get those seizures under control. That group of medically refractory epilepsy is what really motivates a lot of research, including stuff we do in the lab. It's not unique to TBI, but of course many people that develop epilepsy from TBI do end up declaring themselves as having medically refractory epilepsy. And so we really need to understand these cellular molecular changes to develop new effective therapies. And one of the things that we've been looking at in the lab and many other laboratories is the role of inflammation in triggering that. So all these neuroinflammatory responses to injury are believed to be really important in setting off this trigger, this ongoing cascade of changes in the brain that eventually is altering network and circuit function to promote seizures. So EEG is the most important tool to diagnose epilepsy, and it's really just recording electrocerebral activity. Our brain is an electrical device, and so we're simply recording voltages with electrodes we can place on the scalp at different locations, and that's going to signify areas of abnormal excitability, which is seen as what we call spike wave discharges or sharp waves. So those are one of the things, not just in research, but in clinical care that we focus on and are looking for when we're doing EEGs. The other main function of the EEG is to help localize where the seizure starts from. We can often at least lateralize to one hemisphere of the brain where a seizure starts with scalp EEG. But for this group of medically refractory epilepsy patients, there's more advanced EEG techniques that deploy intracranial electrodes. That gives us very granular information about where a seizure starts and where it spreads. It can even distinguish parts of a single brain structure like the hippocampus. Does it start in the anterior or the posterior part of the hippocampus? And that can impact other treatment options, including in some cases surgery. What I just shared with you wasn't specifically related to EEG data and research, but in broad terms, that's how we use EEG, and including in animal models, the EEG is crucial to prove that this is an electrographic and electrical issue that's causing changes in animal behavior. Yeah, I think that the challenges for human tissue is one, just access. And some of the laboratories that have been more committed and accomplished looking at human tissue have really close partnerships with neurosurgeons. A lot of this tissue comes from epilepsy surgery, from this medically refractory group of patients that actually are surgically treated to improve their seizures. So that's one downside of human tissue, is that it's always going to be associated with some degree of pathology. It's never pure, normal, healthy brain in most instances. But a big advantage is that we have learned some new things about how human neurons function differently than rodent neurons, for example, where most everything we know about ion channels and neurotransmitter receptors has all been studied and investigated and described using rodent tissue. So that's a huge advantage. It's more reliable, more accessible, and there's more experimental flexibility working with those models versus humans. I pretty early on became interested in epilepsy when I was a graduate student, because I did work studying ion channels, these specific membrane proteins that function in very dynamic, exciting ways with interesting pharmacology. And so ion channel physiology is so relevant to both the pathophysiology of epilepsy. These are the molecules that cause neurons to become hyperexcitable or otherwise dysfunctional. And so that's kind of what drove, and they're the targets for a lot of the therapies we use. So that's what really got me interested in epilepsy, was that basic science exposure. And it is incredibly, again, I mentioned brain science borders on mysticism a little bit because things we don't understand. But that's also really fascinating about epilepsy, the symptoms that people experience and the behavioral changes that they may undergo during an epileptic seizure are so broad and wide. I mean, there's such a wide spectrum of symptoms you can see. That's also kind of a challenge in diagnosing and treating epilepsy, but it makes it incredibly interesting. And a lot of these symptoms can be purely subjective stuff, like sensation of euphoria. So the famous author, Dostoevsky, had epilepsy, the Russian author. And so all of his books, there's someone with epilepsy in his stories. And he's, being a novelist and a writer, describes some of his auras in great detail with this, intense sensation. It was fleeting, but sometimes it could be rapturous for people that suffer these things. That's a challenge for everybody, and it's a difficult balance to strike, but I think most people that are physician scientists really feel that their experience and interest on both areas doing basic science research informs my approach to clinical care. And clinical care and being exposed to patients informs some of the research questions we try to ask. So that part is kind of easy to balance because I think they do really become connected and benefit one another. Answer. So specifically in terms of diversity, being in a place like Seattle or in Washington, University of Washington, it's a little bit easier because I think we are a fairly diverse student group of students. Certainly in the medical center, there is quite a bit of diversity. I don't know that any of my specific efforts or research directly is applicable to that. So that's a tough one for me to answer, I think, real credibly. Other than, supporting, students of different, background, ethnicity, and encourage them to be involved in research. Of course, some of those things are a little bit under attack right now. There has been specific efforts by funding agencies to encourage people to go to medical school from underrepresented groups. And some of those are not being supported the way they once were, which is scary and it's an unfortunate thing, but that is true. I think that studying neuroscience and science in general, and for me studying biology, has helped me maintain some childlike curiosity about everything in life. And I think that that's been healthy for me in my professional work, being excited and finding things to be interested in, and being excited to come to work and really fascinated by what we do. I think it's trickled over into other parts of my everyday life, maybe not specifically neuroscience, but I really enjoy learning about botany and being able to identify trees. I think like a lot of people, more recently I've become a bit of an amateur bird watcher, and so that's not directly related to neuroscience, but it's kind of related in the sense that just a real interest in biology and nature. Something to share with the audience at large about neuroscience is to reinforce some of my other comments that it's endlessly fascinating. It's always something new, and there's so many different levels that people work at in science in general and in neuroscience in particular. There's people that are really computational, approaching these things from theoretical, mathematical perspectives, and trying to understand some of the engineering of the brain. And then people that are really looking at animal behavior or functions of a specific protein. So there's all of those different levels that are sources of interest and enjoyment for me working in neuroscience, and again, just always something new to learn.